My name is Ann Holden. I'm doing an informative speech for Speech 101. Date is July 8th, 2017. I am doing my informative speech on rheumatoid arthritis. What are the daily tasks that we take for granted every day? It's hard to think of what them are. If you were to ask the same questions to the person who suffers from rheumatoid arthritis, you will be shocked of what they say. Things like buttoning your pants or your shirt, opening a jar is next to impossible, and brushing your teeth and combing your hair is next to impossible. These are just a few things that is very difficult for a person with rheumatoid arthritis. Unlike other forms of arthritis, rheumatoid arthritis is a form that severely disables and disfigures the person who suffers with this disorder. Today I'm going to talk to you about the rheumatoid arthritis and why it is so different from other forms of arthritis, and how it is treated and how people live with this condition. Rheumatoid arthritis is classified as an autoimmune disease and not a form of arthritis. The body's immune system is programmed to protect us from invasions of foreign antibodies that cause sickness. Rheumatoid arthritis creates a confusion in the immune system. This confusion causes the antibodies to attack the cartilage and the bone of the joints, which causes the destruction of the bone and cartilages. This happens in every joint of the body, and not just your hands and your feet. This attack causes the swelling of the synovial membranes, which in turn causes the joint capsules to swell and is the most noticeable sign. As an autoimmune disease, rheumatoid attacks any area that swells. The disease is classified as systemic. Sorry. This disease can affect any organ of the body, not just the joints. It can affect the eyes, the lungs, the heart, kidneys, disease, liver, and that's just to name a few. Because of the autoimmune response, those affected by rheumatoid are predisposed for the development of the other major conditions such as heart disease, osteoporosis, periodontal disease, and some other cancers. Rheumatoid is primarily a disease of age. The disease normally occurs between the ages of 38 to 50. It can occur early in life. When it does occur early, the earlier, the more severe the disease will be. Women are more likely to develop the disease than men, and the direct cause is not known. The likelihood of development of the disease is greater if it is prevalent in your family, but there have been cases with no prior genetic markers. The initial signs and symptoms do mimic regular arthritis, but early detection is needed for optimal control. Signs to look for are increased fatigue, joint stiffness, swelling, and painful palpitations to the knuckles of the hands. Unlike forms of arthritis, rheumatoid can severely disable those affected, and the treatments for the disease have damaging side effects as well. The disease has no cure. It can only be managed. The main goal of treatment is to prevent further damage, but even this comes at a cost. Treatment aims to prevent further damage and provide relief for the patient. To achieve moderate relief of symptoms, most patients need to be on multiple medications. It is common for people to take at least 3 to 4 medicines daily with an additional 2 to 3 medicines weekly. Patients are normally given a steroid along with methotrexate to combat initial swelling. The steroid given is prednisone. Many complain of heart palpitations while taking this medication. After the initial treatment, ongoing management is a guessing game to find the right combination of medicine. A normal drug regimen will consist of 3 to 4 pills a day. This leads to gastric upset, yet another side effect. The patient will also be placed on a specialty medicine. These could pill or the prevalent form. This could be a pill or prevalent form of IM injection or IV administration. If you have the IV form, you have to take off work 1 day a month to receive it. Yeah, bosses do not like that. The IM injection has to be refrigerated and is very painful. I have mentioned a few side effects, but those are just beginning. Taking all this medication can be very damaging to the liver and kidneys, so blood tests have to be done regularly. Also, a few of these medicines, like Plaquenil, will damage your vision, so regular checkups with multiple doctors are required. Because rheumatoid is an incurable disease, chronic depression can become a factor. A good support network is needed. This disease is progressive, and there will be good days with little pain, and there will be bad days with a great deal of pain. This emotional roller coaster can create havoc on a person's well-being. Unlike arthritis, rheumatoid disease in its late stages can cause severe disability and disfigurement. So far I've talked about rheumatoid and how it is treated. Now I am going to talk to you about living with this disease. You now know that there will be medications, side effects to deal with, as well as the roller coaster ride of flare-ups. You also know about the danger of depression, but how does a person live with this? They take it day by day. All researchers prove that exercise is pertinent for joint health. This is not an easy task. The so-called experts say that even during a flare-up, that low-impact aerobics are effective. I have to wonder if they even have a clue what it feels like to have a severe flare-up. Walking is a great exercise and easy to do if you have good supportive shoes. Memory foam and soles help even more. When not flared up, an elliptical can be tolerated. When the disease has progressed to the advanced severe stages, any type of activity is very difficult. Walking in your house becomes a chore. Everyday tasks becomes very tiring and often challenging. You know that you have to keep moving or your body will become very stiff. The absolute best way to exercise your joints when suffering from rheumatoid disease is to work out in a pool. The gravity is removed from our bodies while underwater, thus relieving pressure and making movement easier, and provides natural relief, even if it's just temporary. In conclusion, today you have learned what rheumatoid arthritis is, how it is treated, and how to live with the disease. I would like to add that because it is an autoimmune disease, you really have to be proactive when it comes to general health. Any sickness will be worse with weakened immune system. To live life to its fullest, you need to change and adapt your normal behaviors. You can still do what you love, you just have to readjust how you do them. The act of bending down to a garden is very painful and makes performing your favorite hobby near impossible. I love to garden, so my husband made me these special gardens so I could enjoy what I love to do while I battle this condition. Thank you.